Well, tonight's Health Connections, we are talking orthopedics. Joining me now, Dr. Danes and Dr. Likes from Parkview Medical Center up from Pueblo. Thanks for being here, gentlemen.
Thank you.
Very good. So we're talking orthopedics, muscles, cartilage, tendons, ligaments, joints. Let's start with your training and your education and what you kind of specialize in.
So I specialize mostly in shoulder and elbow surgery. I did my orthopedic training at University of Iowa, got a nice general orthopedic education from that, and then I went on and did a year of just shoulder and elbow surgery and specialty training at Oxford University in England.
Very good.
And I spent 5 years at St. Vincent in Toledo, Ohio, doing my orthopedic surgery residency, and then I went on down to Columbus, Ohio at the Ohio State University to do my sports and shoulder fellowship.
Very good. So when somebody's complaining of, shoulder pain or knee pain, I feel like some folks often are hesitant because they're like, I don't want to have surgery, but that's not always the case. They don't always have to go straight to surgery.
Absolutely true, and I would say that probably the majority of people referred to my office for shoulder pain end up not undergoing surgery. We have a variety of different options for treating patients who have pain and disability from that pain. And in fact, we use therapy, we use injections, we use medication, and like I say, probably the majority of people don't end up needing surgery.
Right.
That was a nice summation, but I would agree with that the majority of injuries that are orthopedic do not need an operation, and we can help sort through that when they come into the office.
And technology playing a huge role in not having to have surgery or having minimally invasive surgery, correct?
That's correct. A lot of the arthroscopic procedures that we do are minimally invasive, and they can be outpatient procedures, and kind of some of the latest and greatest things going on in orthopedics are through the arthroscope.
What kind of typical injuries are you guys seeing this time of year?
Well, sports has started, and so we're starting to see athletic type injuries. We're seeing patients come in with shoulder pain, variety of different mechanisms of that injury. A lot of football players coming into, and most of them wanting to keep their season going this year.
And with all the recreational activities in Pueblo, we certainly see our fair share of ATV accidents and things involved at the reservoir and whatnot, and it's just a busy population.
So what's tougher to recover from, knee surgery or shoulder surgery?
Absolutely depends on which knee and which shoulder.
Sure.
Injuries come in a huge variety of flavors, and it all depends on what's happened and what needs to be done to fix it. And so I would say that varies a lot more on the injury than it does particular joint.
Sure.
And I would have to agree with that.
Yeah, very good. Well, if you've got questions, we have the perfect avenue for these guys. So thanks you both for being here, by the way. But you go to coloradoconnection.com. Our live chat actually starts at 7 o'clock tonight, so log on and chat away and ask all the questions that you've been wondering about the world of orthopedics. So thank you guys for being here.
Thank you very much.
And we are back after the break.